Hello and welcome to this video. In this video, we are going to discuss about preparation before you carry out any indirect restoration. What things you need to prepare or plan before you doing those onlays, crown or veneers for those patients. So let's look at some of the things which you need to make sure that you've done before you actually do the treatment. So the first thing you need to do is clinical assessment. You need to make sure you assess the restorability of the tooth. You assess the endodontic status, you assess the periodontal status, and you assess whether the tooth is in alignment with the other teeth or in the alignment where you want it to be. Because if you are doing indirect restoration, you can change shape of the teeth, you can change the direction of the teeth sometime, and this is something you need to discuss with patient. Whether many times patient wants veneers because they want to avoid orthodontic treatment. Again, I personally do not approve that treatment. However, the circumstances are different, and there may be circumstances where patient may need veneers because for some reason or the other they cannot have orthodontic treatment. But you need to understand and make sure you assess this from the outset. You need to do radiographic assessment, make sure there is no periapical lesion, and the quality of the root canal is good. If patient has poor quality root canal treatment, then I do not feel comfortable in doing any indirect restoration on that tooth until the root canal treatment has been done up to a standard. Now, patient may not have a periapical lesion on that tooth, but I explain to patient that, look, by doing a crown, by removing this old restoration, doing a new core buildup, we are changing environment of the tooth, and there is a high risk that the tooth can become painful or infected because the root canal is not done properly before. And if patient doesn't have any periapical lesion, just a short root canal treatment, if you're doing an onlay on that patient, which is easy to go through for endodontist, then maybe it's up to you and patient to decide whether you feel comfortable in doing that and taking that risk. Always take photographs of patient smiles before and after. I cannot stress enough on taking photographs routinely for all your treatments. You need to take the shade of the tooth before you start the procedure. If we are not sure of the shape, then we will do diagnostic wax up. I would have shown patient a diagnostic wax up. I would use the diagnostic wax up to make my provisional so that patient can go home and try that out as well. I would select which material I'm going to use, because if I am using, let's say, PFM, porcelain fused to metal crown, then the preparation of the tooth is completely different than if I am doing monolithic zirconia crown. So it's really important for you need to assess what material you're going to decide, and that will also depend upon whether you can bond the restoration or not. If the restoration is subgingival, what is the condition of the tooth, what is the position of the tooth in the mouth. There are lots of reasons, lots of things you need to consider, but you need to make sure you consider the material you're going to use of the crown before you prep the tooth. You need to assess the design, whether you are going to do onlay. Let's say if you're doing onlay, you're just going to cover the top, or you're going to do buccal and occlusal, so veneer lace, as people have coined the term, where sometimes onlay, because the junction of the onlay can be visible on the tooth, patient wants the nice buccal aesthetic, then you can do buccal onlay, buccal coverage with the occlusal coverage, and that's veneer lace. But you need to really design that before you put the drill to the tooth. You need to make sure what type of provisional you're going to give it to patient. Are you going to make prefabricated like a shell and then reline in patient's mouth and then cement it, or are you going to use your diagnostic wax up? Or if you don't have diagnostic wax up, are you going to take the indices before you start preparing the tooth so that you can make patient a provisional tooth? But you need to assess this before, and you need to decide this before you start preparing tooth. And finally, you need to decide whether you're going to cement or you're going to bond the restoration. As I said before, if you are going to restore the tooth which is subgingival and you're not doing any DME, deep margin elevation, then it is unlikely that you're going to bond, or you will be able to bond predictably that tooth, and that's why you need to decide most likely towards the cementation and use a conventional cements to cement the crown. So I hope you found this checklist useful. Make sure you go through this checklist, print it out, keep it with you whenever you're doing any indirect restoration, and go through this checklist and make sure that you ticked all the boxes. So I hope it was helpful. If you have any questions, please feel free to contact me.